Okay, so we're going to begin. Thank you to everyone who's joining us today. My name is Lindsay. I am a knowledge broker here at Gambling Research Exchange, Ontario. And for those of you who are in the platform already, you will notice that your microphones have been muted upon entry. And that's by design to cut down on some of the background noise while the presentations are going on. During the presentation, it's kind of broken into two pieces and then a Q&A. So our presenters will stop at the end of their presentations. I'm sure if there are any burning questions, they can answer them at that point. And then at the end of both presentations, we'll open the floor for a 15 to 20-minute Q&A session. And at that time, there's a virtual raise hand function through the software. And if you virtually raise your hand, I can see that you'd like to be unmuted, and I will unmute your microphone for a question at that point. Just a reminder, if you could remember to put your hand back down afterwards, that helps me to know that you no longer have a question. If you don't have a microphone to speak into, you can also send questions via the chat function or the Q&A function, and I'll do my best to moderate them. Though sometimes at a high volume things get missed, but if they do, I'll make sure that the presenters connect with you afterward. And I believe that is all. So we are going to start the presentation with Tara, and she is affiliated with the Center for Urban Health Solutions at St. Michael's Hospital. She has research interests in addiction, problem gambling, poverty, qualitative methods, and participatory action research. And I'm going to hand it over to Tara.
Great. Thank you so much, Lindsay. Hi, everyone. I'm going to be presenting today on a white paper entitled Poverty and Problem Gambling. To start with, I thought I'd provide a bit of a roadmap of how the presentation will unfold. The presentation will report on findings from a white paper on poverty and problem gambling. It will take you through a brief overview of the link between poverty and problem gambling, sort of referencing the academic literature on the topic. I will also address some of the findings from an article that focused on individual and neighborhood level disadvantage and problem gambling outcomes. I will conclude the summary of key findings highlighted in the white paper, as well as provide recommendations. So to contextualize the presentation, we'll provide a brief overview of the academic literature and what it has uncovered on poverty and problem gambling. The prevalence rates of problem gambling in homeless populations are significantly higher, at roughly 9 times the rate of the general population. A relationship between problem gambling and poverty is identified in the academic literature, but what remains less clear is the temporal order. Sharman and colleagues in a recent study out of the UK attempted to determine this sort of temporal order. They asked clients of a London homeless shelter about their life history, guided by a structured instrument on life events. And they found that those who gamble excessively, the majority report gambling problems preceded homelessness. The authors concluded that 2 important life events may lead to homelessness, and that is gambling problems and job loss. So I'll now move on to describe a bit about the state of the literature in the topic area. We assessed the state of the academic literature employing recommendations of ARCSI and O'Malley on how to conduct scoping reviews. They suggest a 5-stage approach that we followed. This included the selection, charting, and synthesis of data. For article selection, we searched 8 academic databases, such as Medline, PsycInfo, ProQuest, amongst others. In the databases, we searched for relevant articles using the search terms problem gambling, poverty, homelessness, unemployment, precarious housing, and neighborhood disadvantage. We included studies that use problem gambling diagnostics or screening instruments to ensure some validated measure of problem gambling. And 20 studies were deemed to meet this inclusion criteria. We also drew on some additional gray literature for this report. So research from the United States, Canada, Australia, and the United Kingdom spanning roughly 2 decades have reported on this link. Measures of inequality found in the literature include low income, homelessness, and neighborhood disadvantage. Studies largely focus on individual level disadvantage rather than neighborhood level, and do not draw in large representative samples generally. For some studies, samples are drawn from specific populations such as Indigenous groups and those with complex social health needs seeking treatment or other supports and services at agencies. The field of research is still developing, and the focus of most research to date is on the establishment of prevalence rates of problem gambling within this population. A few qualitative studies exist on the topic. Our review uncovered 3. So following suit with other white paper formats, an article that contributes to the literature in a unique way tends to be highlighted, and this white paper focused on one such article. So of the studies meeting inclusion criteria, one academic article out of the United States used a representative sample to investigate disadvantage not only at the individual level but also at the neighborhood level. And this makes it sort of a unique study with respect to the sample, statistical techniques used, and the unit of analysis. The authors determined that neighborhood disadvantage was a significant risk factor for problem gambling, and that is those living in the poorest neighborhoods had significantly increased odds of developing a gambling problem, being almost 30% more likely to develop one. The findings from the study suggest that neighborhood disadvantage significantly predicts frequent and problem gambling, even after accounting for key socio-demographic factors, including age, gender, race, ethnicity, and individual socioeconomic status. So continuing on with Barnes, Barnes and colleagues also found that at the individual level, problem gambling was highest for those with low socioeconomic status compared to those with higher socioeconomic status. Men were 2 times as likely to be problem gamblers when compared to women. African Americans had significantly increased odds of being a problem gambler when compared to other racial groups. And that is strong effects of individual characteristics on gambling behaviors and problems were found in this analysis. Being male, being Black, and having low socioeconomic status are significant risk factors for problem gambling, according to the authors. Returning back to neighborhood level factors, so combined, those with the lowest level of socioeconomic status derived through income, and those living in the poorest neighborhood had significantly increased odds to develop a gambling problem. So that is the negative effect of socioeconomic status on gambling problems are enhanced with greater neighborhood disadvantage. The authors draw on the concept of concentration effects to explain their findings. So that is, living in areas with high concentrations of poor neighborhoods enhances the probability of developing a gambling problem. That is, a context where access to jobs, job networks, quality schools, and exposure to conventional role models are scarce is one that is ripe for the development of gambling problems. So I'll provide a brief summary of the broad findings on poverty and problem gambling. So in sum, the economic and social costs of gambling are increasingly shouldered by those who can least afford them. As per Statistics Canada data, those in low income brackets spend a higher proportion of income on gambling than those in higher income brackets. Which is a concern given that gambling-related harms are said to increase significantly when more than 1% of household income is spent on gambling. Some research suggests that those who are more economically disadvantaged may see gambling as a way to improve their financial circumstances. Not surprisingly, the literature suggests that those living in poverty, with lower income, or who live in economically disadvantaged neighborhoods are at greater risk of developing gambling problems. Specific subgroups were particular attention according to the research, as they may be at greater risk of developing gambling problems. And these include the unemployed, those experiencing homelessness, those living with complex social and mental health needs, racialized persons, older adults, veterans, and men. So to conclude, I will provide some recommendations extracted from the literature. The evidence provides some prevention-based and service delivery options. One, this includes enhanced awareness of the link between problem gambling and poverty, and of the services and supports for those experiencing problem gambling. So this is needed for both the general public and service providers. Dwelling on the latter group, it is particularly important for those who serve individuals experiencing poverty and other complex social health needs to be made aware of the link in order to better serve their clients. Communication training is particularly important for service providers to begin the conversation with clients on the topic that is not always easy to broach. Skill development is also needed to address problem gambling within the context of poverty. That is, service providers need not to only develop awareness and knowledge, but they need to be able to know how to address this problem. That is, how to administer screening instruments to determine if there is a potential problem, and to know where to refer clients for services and supports. And service providers need to understand that problem gambling, although likely a part of a host of other challenges facing clients, and this is often discussed in the literature, might be a key factor in their economic and interpersonal hardships. So it's an important thing to really hone in on. Tailored, culturally appropriate, and integrated care for those experiencing problem gambling and other complex social and health needs is also needed. One study conducted in Toronto by Gilcher and colleagues found that those experiencing problem gambling, poverty, and other complex social and health needs asked for more treatment support such as talk therapy and services that are located in one spot for ease of access. This type of centralized and integrated support would likely enhance uptake for this population. Thank you all for listening in today, and please feel free to ask questions after David presents at the end of this. Thank you so much.
Thank you very much, Tara. And just as they flip their slides over, does anyone have any super burning questions? I think some of the context you'll learn from David's might lend itself to questions at the end. So I will introduce David. He is a PhD student in Public Health Sciences at the Dalla Lana School of Public Health, University of Toronto, and is a research coordinator at the Center for Urban Health Solutions at St. Michael's Hospital. He is interested in examining the social determinants of addiction using qualitative, quantitative, and community-based research methods. His work as a student fellow for Gambling Research Exchange Ontario includes qualitative interviews and a scoping review on the topic of problem gambling and crime among youth. David holds a master's degree in socio-legal studies from York University, where he was awarded the Joseph Armand Bombardier Canada Graduate Scholarship from the Social Sciences and Humanities Research Council. Looks like David is all set, so I will let you take it away, David.
Great, thank you, Lindsay, and thank you everyone for joining us today. So my presentation is going to be on problem gambling and crime. The goal of this webinar for me is to help you get an overview of the literature on this topic. So I want to go through why it's important to know about this, why it occurs, who's affected, and what we can do about it. So why is it important to know about problem gambling and crime? So there's financial cost to governments and citizens as a result of problem gambling and crime. And now I just want to preface this, though, with the fact that the data on this is fairly limited right now. There's data points from various countries, but it's hard to compare the data points and understand what these numbers mean. But I'm going to try and do my best to give you a sense of what the financial costs of problem gambling and crime are using this information. So in the U.S., there's some studies that show that the costs of arrest and incarceration overall per person experiencing problem gambling are $1,250 per person. And in Nevada, this number goes up to $2,000, $3,000. The lifetime cost of arrest per person experiencing problem gambling in the U.S. Ends up being $10,000. Now, there's some studies done in Australia as well about the actual costs of the crimes committed by people experiencing problem gambling. So there's one study that examined court records and found court records of 63 people, and found on average, per person experiencing problem gambling, the cost of goods stolen ended up being $66,770,000 per person. Now, not all of those crimes were gambling related. I think about 73% of those were gambling related. And there was another study on 156 people experiencing problem gambling that examined the cost of gambling related fraud. And this number per person was actually a lot higher, and they found that it's around $100,000 per person. So Great Britain does some great monitoring studies on problem behaviors. It's hard to kind of contextualize this information, but I think it still helps to know that there are some countries that are doing this research and other countries that are behind on it. So Great Britain shows that, like in their research, they found that the cost of problem gambling crime to the criminal justice system was around $40 million to $190 million per year. And it's hard to compare that to like substance abuse issues. I tried to look for the data, but the way that these numbers are calculated aren't comparable. So instead of comparing it to another problem, you can see that from this table here that this table shows the consequences of other, the consequences of problem gambling in other areas. And you can compare it to incarceration, where you see incarcerations, the cost of problem gambling is $40 million to $190 million, estimated to be. And that comes in second place overall to the other consequences of problem gambling, the first one being hospital inpatient services. But what's a little bit worrying is that in Canada, as far as I know, there's no research on the costs of problem gambling and crime. So we are a bit behind on that. So the personal costs of problem gambling. Problem gambling crime. Problem gambling crime can also affect individuals, and there are costs to both problem gambling, some that Tara described, and costs to crime, which exacerbate each other. So there's personal financial costs, for instance, from both problem gambling and crime. Often this leads to employment issues, like in the cases of embezzlement or stealing from the workplace, as a result of trying to chase gambling losses. Problem gambling and crime can also show up in kind of materialize in family dysfunction in terms of gambling losses leading to domestic violence. Of course, there's legal issues and mental and physical health issues also associated with both of these problem conditions. So just to put this into context, the prevalence, I'll describe the prevalence rate. So from the many studies I read on this, I found that there's about half or more of the sample of people experiencing problem gambling that self-report a crime. The numbers ranged something like 40 to 70% of the samples reporting a crime. So globally, problem gambling rates are from 0.4 to 7.5%. But in Canada, the latest adult rates, which are not that recent, they're from 2005, estimate that the rate of problem gambling is at 2%. So just to kind of help you see what that means in terms of the prevalence rate of problem gambling crime, I just did a crude estimate using 2017 population statistics from Canada, and this turns out to be around 300,000 people, adults in Canada, experiencing both problem gambling and committing criminal behaviors. But don't quote me on that. That's just a crude estimate to give you some context. So why does problem gambling and crime co-occur? So first, just to see what types of crimes problem gambling is associated with. You can see this list here. There's a variety of different crimes. Go from carrying weapons to theft at work to assault to speeding and sometimes even vandalism. It's kind of hard to get a sense of why these crimes co-occur with problem gambling because there's so many different types. The topmost reported crimes that occur with problem gambling are embezzlement and theft of personal property, like you might expect. But again, going back to the point of how there are a variety of different types of crimes that go along with problem gambling, you can see that it's hard to explain. And the literature has two hypotheses for this type of to explain why these co-occur. The first is the instrumental hypothesis, where they describe that crimes that are associated with problem gambling occur as direct results of problem gambling. So gambling losses, gambling to fund gambling activities. And then there's the symptomatic hypothesis that explains that problem gambling is shares risk factors with crime, like, for instance, low SES, that lead to the co-occurrence of these behaviors. So of the instrumental hypothesis, I'm going to describe to you problem gambling related consequences that lead to increases in crime. So the more severe gambling problem is, the more likely it is to lead to a crime. There's one study that found that the likelihood of committing crime increases by 4.28 to 7.6 percentage points compared to people who don't have problem gambling, and that's for problem gamblers. Higher gambling losses are associated with a higher propensity to commit a crime. That's both financial crimes and violent crimes. And what was surprising to me, because I didn't think about this before I was interested in problem gambling and crime, but violence, especially domestic violence, is, some studies show that it's directly related to things like gambling losses. And there's a quote up here that, there's a quote up here that kind of illustrates that point from a longitudinal qualitative study by Reith and Dobby from 2013, and it's by an anonymous male in his 30s. He said that I was just desperate, basically, and it was roulette machines that done that to me. Before, I wasn't like desperate. I would never steal off anybody for gambling. I would never commit a crime for gambling, but the roulette machine just totally changed me. That's what destroyed me. I became very aggressive. So there's also the financial motivation for problem gambling and crime. And some research has tried to investigate why people experiencing problem gambling resort to financial crime. It turns out that financial crimes, and also other crimes too, but occur later in the development of problem gambling when gambling problems intensify. And this happens for people who would have not otherwise committed a crime. And the reason is because people first end up exhausting the financial sources available to them. So they'll collect debt, and they'll borrow money from other people. And once those sources are exhausted and they still have their issues with problem gambling, some might engage in other crimes to fund that. And it's all motivated by, one of the explanations is that it's motivated by a need to chase the gambling losses for the potential that they might one day win. And sometimes this activity, criminal activities, are associated as borrowing. For example, that they can rationalize it as a activity, or they can rationalize the stealing as something they will pay back once they have a big win. So then I also described that the other hypothesis to explain problem gambling crimes is the symptomatic hypothesis. So as you can see from this slide, both problem gambling and crime share a number of risk factors that can increase the likelihood that they'll co-occur together. And these risk factors can lead to these behaviors separately. So there's a number of these risk factors that include inadequate parental supervision when people are younger in their adolescence, factors like predispositions to impulsivity, having a family member who's arrested, peers who engage in problem behaviors, coming from a low SES background, having poor neighborhood resources and services, high levels of anxiety and trauma. Now, these risk factors are also shared by other problem behaviors, such as mental health and substance abuse. And this is one of the difficulties in the research literature right now, is trying to understand how these behaviors influence each other, because as far as we know right now, the literature seems to indicate that there are complex relationships between these behaviors, that they actually influence each other. So for example, having a mental health issue can lead to increased problem gambling, then having a gambling loss can lead to more mental health issues, and that could also lead to substance abuse, for instance. But we don't, the literature is not very clear on how all these pathways occur, and more longitudinal studies are needed. So who is at risk of problem gambling and crime? So one of the population that I study in my research is adolescents. So adolescents' problem gambling rates are actually higher than adult rates, 2 to 4 times higher than adult rates. Compared to adolescents, adolescents are especially vulnerable to problem gambling and crime, just because they have more problem gambling, but also because they're more likely to commit non-income producing crimes like violent acts, whereas they're also similarly, they commit financial crimes at a similar rate to adults. Adolescents with problem gambling are also more likely to become incarcerated than adults, but the research on this is not recent, so we need to update that. So people experiencing incarceration also experience higher rates of problem gambling compared to the general population. And this isn't really a surprise because we know that problem gambling and crime are associated with each other. But people experiencing incarceration are also more likely to experience recidivism if they experience problem gambling compared to, for instance, other people that are experiencing incarceration that don't have an issue with problem gambling. And what this indicates is that there's a cycle of problem gambling, crime, and being incarcerated and coming out of the prison system, and still having the problem with gambling, and also committing crimes again and going back into the system. So this is similar to substance abuse as well. For substance abuse, we have, there's substance abuse treatment, or drug courts, sorry, that try to address that issue, whereas for gambling, gambling treatment courts are kind of an experimental thing right now that people are trying to think through. And there's issues with it in the sense that, it's not, you can test for if somebody is still using substances, but it's much more difficult to test if somebody still has a gambling problem. So most people who are incarcerated and experiencing problem gambling will never seek treatment. And this is a serious issue because of the cycle of recidivism, crime, and gambling. It's very important for us to think about ways to target this population and to introduce treatment to them. So what can we do to address problem gambling and crime? So I thought of a number of recommendations, and of course the literature is not very strong in these areas, but based on what we know, there are some possible pathways to solutions that we can think about. For instance, one of these possible things we can do is develop stronger connections between problem gambling treatment services and credit counseling services, because we know that there's a link between problem gambling and financial crimes. And if we have credit counseling services, that can help some people who are trying to recover from problem gambling, for instance, to deal with one issue such as high debt loads that might be holding them back from treatment. Another is to improve awareness of problem gambling specific treatment and prevention programs that include money management training. And that's for the same reasons as number one. Another is develop and raise awareness of programs that target multiple risky behaviors, including substance use and problem gambling. And that's because we talked about there's complex comorbidities between substance abuse, problem gambling, crime, and mental health issues. And actually there's a study that we're still writing up right now of qualitative interviews with service providers, for adolescents at least, in services for problem gambling, that show that they agree that, for the most part, they agree that there are, this is an issue of multiple risky behaviors, and services for these behaviors need to be holistic and consider how all of them work together. The fourth recommendation is to screen for problem gambling and to refer to problem gambling treatment services and substance abuse and mental health services. That's for similar reason that these behaviors are connected and that we should create bridges between these siloed services. Fifth recommendation is to screen for substance abuse and refer to substance abuse treatment programs and problem gambling programs. And that's, again, for the same reason, just switching that around. Sixth recommendation is to screen for problem gambling in correctional facilities and provide options for treatment. And that's because we know that people experiencing incarceration don't seek treatment based on their own, and so it's important to help stop that cycle of recidivism. Seven recommendations to develop gambling treatment courts and evaluate their effectiveness in reducing crime related to gambling. So again, we said that we don't have any concrete solutions for that at the moment, at least that I'm aware of. And it's important to see if there is a possible solution there that we can do that's similar to drug treatment courts. The recommendations to target adolescents in and outside of the juvenile justice system for problem gambling, screening, prevention, and treatment because of their vulnerability to this issue. And I don't have it here, but there's also, if you can recall from the slides, the shared risk factors that influence both problem gambling and crime. There are many risk factors there that could be targeted for prevention and treatment. So for instance, tying back to Tara's presentation, low SES is a risk factor for both, well, as Tara said, for problem gambling, but it's also for crime. And this might be a population that we should consider providing prevention and treatment efforts towards. Some references here. And that's it. Thank you very much.
Thank you very much, David, for that presentation. And before I open the floor for questions, I just want to also let you all know that we have one more member of the team on the mic over at St. Michael's Hospital. Dr. Flora Matheson is a medical sociologist and mental health and addiction specialist. She is particularly interested in how gender inequities and other social determinants of health affect people experiencing problem gambling and substance use, mental illness, poverty, housing instability, and imprisonment. She has particular expertise with knowledge translation approaches and working with community-based partners. And so Flora will also be able to answer any questions. And just to kick it off, I know you touched on this really briefly at the end, David, but I'm wondering, just for the sake of our audience and framing some of the questions for the next bit, can you discuss what the link is between your two content areas, so poverty and problem gambling and crime and problem gambling, where in the literature those intersect a little bit?
Yeah, so as far as I know, problem gambling shares risk factors for crime, and one of these risk factors is low SES status, so poverty, experiencing poverty. There's not a lot of research on this for adolescents, but I think there's some for adults. That's as far as I know what the connection is. That doesn't mean that, for instance, that it leads in all cases, like poverty leads in all cases to problem gambling and crime. It just means that because it's a risk factor, it can lead to the co-occurrence of these behaviors. And they could possibly also inform each other as well later on. But again, we need more research, I think, in order to really say what the connections between that is. And I don't know if Tara wants to say anything.
Yeah, like obviously people who are living in poverty and experiencing problem gambling, they have a host of challenges and issues, and some of that has to do with involvement with the criminal justice system. There isn't much looking at adolescent population groups within this specific area, so that's sort of where David's research comes into play.
Thank you. Flora, do you have anything to add to that before we open the floor?
I guess I was just trying to figure out exactly the question. So David and Tara seem to have gotten it quickly, but I was just wondering, you're talking about the link between problem gambling and crime? And
yeah, so how these two content areas sort of inform each other, or how any potential like questions or solutions or ideas within this area might sort of overlap in terms of crime and poverty and problem gambling.
Yeah, well, I think
what the literature says.
Yeah, well, I think as David has said, there's not a lot in the literature, but there's a lot on prevalence that I understand around the links between problem gambling and poverty, or talking about the links between problem gambling and poverty, but not in terms of more robust studies that address the complex needs or the risk factors that might lead to both, and which of those are priority ones or potentially priority ones that could be addressed that might help. So, so I think there's lots to be done in that area yet.
Great, thanks. Okay, so now I'm going to open it up to our attendees. I see there are a number of you tuned in today. If you do have a question, as I mentioned before, you can virtually raise your hand and I can unmute your mic, or you can send me a note via the chat function or Q&A function, and I can moderate those questions on your behalf. I'm not seeing anything pop up just yet. Let me see what else I wrote down. This question is actually, I suppose, more geared toward David, and I'm just making sure I'm not missing anyone. Nope. I'm just wondering, you actually did start to touch on this at some point, but do we know, like at GRIA, we are still very interested in problem gambling, but we're also interested in sort of the issues that correlate with gambling at different levels of harm. So is there any information about what crime looks like among low-risk gamblers or moderate-risk gamblers, and when that sort of where they start to intersect?
Yeah, I think there is. I'm not super familiar what the exact details are about that, but all I know is that there is research showing that the more severe the problem is, and the longer the person has the problem with gambling, the more likely they are to engage in things like theft, even if they weren't a person that would do that before they developed a gambling problem. That's the extent of what I know about that issue. But I can also look for through the literature and give you a reference afterwards.
No, I'm just interested to know what you know really at that point.
Yeah, that's all I know for now.
That's totally fine. And I'm not seeing any more hands raised, so unless something pops up, I'm wondering, oh, actually, just kidding. I have Andrew. I'm going to unmute Andrew. Go ahead, Andrew. Uh-oh. That doesn't seem to be working. Let me see if he sent me a note.
We can see Andrew's question here.
Oh, okay, cool.
He doesn't have a microphone. Can you see it, or do you want me to read it out?
I can see it. Has the info from these presentations been communicated to the proponents of the casino in Pickering or the expansion of Woodbine Casino?
Well,
where has this information
no. The short answer is no, but it's a good question. it's, you know, the policy piece is something that we're working on here at St. Mike's in terms of getting our message out to policy folks, and to, you know, we have talked to OLG about some of these things as well. And I think Rio has been a really major proponent of this. So I know, Lindsay, maybe we can talk about how we might be able to connect and provide some of this information.
Mm-hmm.
And there's also something that I wanted to say. There's some literature out there on the introduction of casinos into communities that shows that over time, not immediately, but over time, it can lead to increases in problem gambling-related crime.
Yeah, definitely with access. Access plays a huge role.
Yeah.
Mm-hmm. So.
Yeah, that is interesting. Yeah, for sure. Perhaps that's a good collaborative project for us in the future.
Yeah.
Do we have questions from anyone else in the audience? So I'm wondering if you can identify that, and Andrew's comment sort of leads well into that. What are a couple of next steps forwards in terms of policy implications? Oh, we have a question actually from Melinda, so let me unmute Melinda first. Let me make sure she has a microphone before I do that. So Melinda's unmuted. She says, according to your research, does poverty cause gambling, and consequently, for some crimes or gambling causes poverty/crime? I don't know. I'm going to try to clarify that a little bit.
Well, from what I know is that there's not a lot of longitudinal research which would let us know about causality or like links between these. For example, poverty causing crime. I think that's exactly probably what you said. There are risks. They share risk factors. We know they're associated, but we can't say that one thing causes the other.
Yeah, well, there isn't much research, as you said, longitudinally to sort of decipher that, but there was that one study I cited by Sharman who they used an instrument to essentially determine different life event points and understanding where gambling became a problem. And usually gambling, they did find in that sample, preceded homelessness. So, you know, you take that for what it is, I guess. Yeah.
And I think in the poverty or the gambling and crime literature and its intersection, we're still trying to work out the ways, the pathways. And I think, you know, I think it's more reciprocal than non-reciprocal. So I think there's probably multiple ways that people get involved with problem gambling and crime, and it may be more fuzzy than unfuzzy. There may be, you know, some people, and the pathway for different people will be different. So I think we don't know for sure, but we do know that some people will, when they get into trouble with gambling, then they will do some things they wouldn't have done before and commit a crime, and then that gets them into trouble. So I think there's more to be done in that area.
Yeah, and just adding to that, I just think the literature speaks to the fact that these populations, especially looking at individuals like living in the margins type of thing, like there's so much complexity to their life stories and the different issues that they're facing that it's hard to really disentangle, you know, where one thing sort of starts and another thing, you know, begins. Like it's hard to put that clearly in sort of a continuum or some sort of ordering. It's very murky, as Flora just said.
Great.
And maybe one of the main risk factors is poverty. I mean, we know poverty is a risk factor for many, many things. And I don't know, like if you think about if we erase poverty, would that help with so many other issues, social issues and health issues in our population?
So I'm wondering if you can identify like 2 or 3 next steps or goals in terms of research or policy implications based on this work that you've presented today.
Well, in terms of the poverty and problem gambling piece, I just think, as I said through my presentation, there needs to be a greater awareness made about the link between the two. Oftentimes I talk to people about this type of research and they're kind of shocked that there is a link. So I think the awareness definitely needs to be sort of made for the general population. And then also, again, for service providers who are dealing with these clients who are experiencing complex health and social needs, there really needs to be an understanding that, you know, problem gambling might be one of those things that plays a huge role in their problems, and it might just be undetected. So, as I said, it would be important for service providers to be able to screen, to assess problems with it, and then provide some sort of guidance on services and supports that they could go to help them. I think that needs to be at the forefront, and you know, Flora can even speak maybe to what's going on at Good Shepherd now with a pilot program. So,
yeah. So I mean, we've been working with the community for quite a while now, working towards solutions and to create awareness around problem gambling and poverty and homelessness. And out of the work that we've been doing, Good Shepherd has been able to implement a gambling addiction program, which is the first that we know of in a shelter system in Canada, where they're actually doing case management for problem gambling with this population. And we did a process evaluation, we're doing an outcome evaluation, but it's looking really good, and they're trying to get out to the community and make other people aware. And I just had a meeting this morning with some folks from Fred Victor, and it isn't on the radar, and so it's just, the first thing is really to create that awareness and then to build opportunities to find solutions. David, did you want to add?
Sure, I could just say that from my own research and from research that Tara and Flora helped on, we did a scoping review on problem gambling and delinquent behaviors among adolescents. And from that research, I can say that in terms of what we need as next steps for research, I think that we need more longitudinal studies for adolescents specifically, showing how, to show if problem gambling causes crime, and what are the risk factors or other moderating factors that increase that potential that problem gambling leads to crime. So what we found also was from the literature that there's not a lot of research on things like how poverty, race, gender, supervision by parents, and family and peers for adolescents to show how that increases crime among people experiencing problem gambling. So that's a research suggestion, I think, that I would make.
Did we lose everybody?
Oh, Andrew can still hear us. I think maybe Lindsay's.
We may have lost our host.
Yeah, we lost our host. I think she's not here.
If there's any other questions, oh, we have someone. Okay.
Sorry, Melinda.
Hi, everyone. I got disconnected. I'm sorry about that.
That's okay. We're just thinking Melinda has another question.
Oh, what is the most common way adolescents gamble according to your studies? That's a good question. Most common way. I can't give you a definitive answer about that. I would say that it's more like with informal mechanisms. Oh, I would say that it's like informal ways of gambling with peers. Things like poker, scratch cards are also accessible, even though they're illegal to adolescents to use, because most people don't really aren't as strict with selling scratch cards as they are with substances and alcohol. That's probably what I would say. Whereas for adults, I think it's more roulette gambling. Or sorry, not roulette, like slot machines that are more common there.
I spoke with a group of students last year, and I was talking about gambling with them. I was asking them what type of gambling that they do or that their peers do, and they talked a lot about gambling personal items. So they gambled things that were valuable to them, like maybe a pair of Nike sneakers or something else. So it was a kind of like, you know, you trade your hockey cards, but they were trading other personal items.
Yeah.
So, and I think we also heard that dice, there's a lot of dice games that kids play. Yeah.
And something that's emerging right now is like other forms of gambling that might not traditionally be considered gambling. Online, for instance, in video games, there's something called skins gambling, where you can buy an item in a video game that has value in the real world, and adolescents can do this. It's not illegal for them to do it, and they can use that item, which has real value, to bet on outcomes for instance, online video game matches or sports or even just coin flip. There's websites that allow you to do that.
Well, even on Facebook, there's also different game options, that are widely used. So.
Yeah, and even in terms of just like apps on your phone, like it's there's a line that's blurry there that we're not sure if it's, like, a lot of people aren't sure if it's gambling. For instance, when you buy something in an app in order to help you gain a level in a video game on your phone, is that considered gambling? I don't know.
And I see that Jackie has a question. I think this will be our last question, and then anything else I can direct you to the presenters directly if you have further questions. Go ahead, Jackie. Oh, and she's silent too. So Jackie, I'll make sure that you have the presenter's information to ask any questions.
Her question is there.
Yeah.
Either answer by research results or educated guess, what percentage of solo gambling gaming occurs versus group gambling gaming? I'm not sure.
I'm not sure either.
Yeah.
For adolescents or for adults?
Well, I'm not sure for either group.
I'm not sure for either group.
There may be somebody content area.
Yeah, there may be somebody online who might know that. Yeah. Great question.
Yeah. Sorry.
Exactly. Okay, so I'm going to wrap it up. I just want to first start by thanking the three of you, Tara and David, for your presentations and pulling that together, and also to Flora for joining us for the question and answer section. To those of you who have called in and who have stuck around for the entire webinar, thank you very much. I'm glad to see that so many of you are interested in this content area. And I just want to remind all of you that I have recorded the webinar in full. So if you missed it or your colleagues have missed it and you'd like to share it, it will be available soon. And all of you who registered through our information email will get a link. And that is all for me. So thank you very much. And if you have any further questions, please feel free to reach out to me and I can help you to get those answers. Have a lovely afternoon.
Thanks, everybody, for joining.
Thank you.
Thank you.